on to the next course, next topic. Dr. Jyothi Matalia, consultant at Narayan Academic. She'll be talking to us on academic evolvement going forward.
Though we all know that when it comes to post-graduation and academic surgery, it's what most of them want. But there is something beyond surgery, and that's what I'm going to be talking about, academic evolvement going forward. So let me just take you through my journey. I did my post-graduation from KM Hospital. And when it came to scale, I'm talking about in 2000, at that time I was doing topical phacoes. So it's something like this, you get a lot of surgeries in Mumbai. And incidentally, I went to attend a contact lens course in the Dr Institute. And I got so fascinated by that, so I decided, yes, I am going to do my fellowship there because I had done surgery. Surgery was not an option for me. I wanted to know something beyond it. And that was my exposure when I thought that I have to go beyond it. And that's when I went ahead and did a fellowship in LV Prasad, and when I got exposed to academics. So when I was in KM, we used to do a lot of surgeries, a lot of patients, but we never thought beyond surgery. That's all we was. And I'm going to tell you what all is needed by academics. So that includes knowledge, presentations, publications, training, and communication. This is what I will take you through. So let me go through knowledge. Now, what we have to understand that we don't know. I mean, you don't know what you don't know until you know, and that's the primary goal of any fellowship. Till you're working in a place, you really don't know what's happening. Unless you get an exposure elsewhere, it doesn't work. And that's what you should do. When you get a golden opportunity to do any fellowship, use and study as much as you want. You have to read books, journals. Now we have the option of recorded webinars also. So there's plenty of material and do it. Because once you pass out, from there you're never going to go and pick a book again. And remember, look at evidence-based medicine. It's just not about related to generally what people are just saying or doing. It's important. And it's only then that what your mind knows, you'll be able to see. And that is the important part of fellowship. Also, when you're with your teacher, watch your teacher examine, counsel, teach. Every bit you should know. Try to have the cases at the end of the day where you can sit and discuss, especially the complicated ones. You should exactly imitate your teacher and learn what to do. But interestingly, you should also be knowing what not to do in certain situations. Ideally, what I'm trying to say, before being a great pediatric ophthalmologist, try to be a great human being. So try to be teaching all your children, the patient, whatever you see, as an entire human being and not just the eyes. The other important aspect that can have and can be a part of the fellowship is a mentor-mentee program. It helps to improvise on ability and capability and helps you sail through very important. So try to have this program incorporated in your system, or there may be many fellowships who already have that. So you are evaluated by your mentor. But what interestingly can also be done is the mentee also evaluates the teacher, and if that happens, then both of them grow equally. That's important. Then also you have a lot of these social media where you can have discussion groups, their opinions in learning. So be a part of them. Stay in touch with the latest news, treatment meetings. So you're constantly learning at that. Like for example, I'm part of all these various groups and they keep on happening. So what a lot of cases where sometime or the other you will be going through, you have a direct access to, you learn, you see others discussing cases and you learn simultaneously with that. And then you should try to look at your niche areas before you decide to start your own. Like for example, as we discussed, you can primarily do something like ROP, you can do pediatric cataract, in addition to what you want to do, your strabismus. Now there's a lot of scope of pediatric neuro-ophthalmology and CVI. There is also myopia, which is on the new kid on the block, and pediatric genetics. So there's so many options to pediatric. It's not like it's a huge thing. So you can choose something which you want to further pursue what you want to do. Presentation. This is something also that you can work on. Primarily start with case discussion, difficult or different cases, the method of diagnosis, management options, surgery, etc. You can present. For that, you need to have very good documentation, and therefore you can start with a case report. Like for example, a 6-year-old child with chronic kidney disease came, and all interestingly was to just look at the fundus, and you can see the papillary syndrome. So this is a small thing that you picked up, but you can use it, present in a small areas where you can show it up. So that can be other things are presenting in journal clubs. You can have didactic lectures, which are like big ones or interactive ones. Newer technology to introduce. Do slit lamp photography with your phones. 9 days photograph app, which we are all friendly about. In whichever phone you have, you can use that. That can help in your documentation. Then you also have to then focus on various studies. like maintain Excel sheets of the squint cataract cases, about the morphology surgery. Once you start maintaining things, you'll be able to pick out so many things that you can use as presentation and also part of publication. Have your research projects in the interest on the topic that you like. Focus should be good scientific content, and beautify the presentation which will add value to any presentation like animations, transitions, whatever you want. So you enjoy doing them and also people like watching them. So that can add to it. So then among your counterparts, you can stand apart. So it's basically to make your things much better by doing this. Then as a part of fellowship program in the institute, you do it regularly. This can be your classes and meetings. Like we have it in our institute. You can be member of various societies like the Bangalore for me, then the Karnataka state for your individual local city and your state conferences that you can do. And also primarily because I'm from Mumbai, these are the other places where I can present. And then importantly, we cannot forget our national AIOS where you get a chance to present. Then your specialty societies which are there, and international societies as well. So there are a lot of places where you start taking small and start projecting so that people also learn in addition to learning your skills and what you have learned. And this is an opportunity to make your work present in the form of oral paper, posters, physically, poster podium, etc., and even presenting a video. And don't forget to give exit exams which are there. Like we have the Rajiv Gandhi University exam, but now we have the FICO that is there that makes your talent also better, and you try to be able to get an actual degree to whatever you have done in your fellowship. Coming to publication, yes, that is also an important thing that you can learn as a part of it. You can have simple case reports or case series, observational interventional series, which could be retrospective, cross-sectional, but plan to have prospective studies, because wherever you do in fellowship, you have a scope for doing it, and try to aim for RCTs before you leave. And try to review articles with your mentor. You could have a lot of places where they review the articles. You try to be a part, so you learn the reviewing process, and then you can help them do that as well. The other aspect is, yes, publication is there. Your local and state society journals and renowned journal like DOS, which has been there for long. A lot of people read it, so try to put something there. And our own IGO, which is now scaling very huge heights. And there are multiple options, like you can put it as a case report, as photo essays, as OMOs, which are there. These are small things. So whatever you are able to do in your practice or in your fellowship, you can even definitely put in, review with your teachers, write for and with your mentors, so that you learn how to write. That is very, very important. This is, as I said, it's important to do best during your fellowship time. Then the other is try, obviously, for high impact journals, finally, where it can help in, and your specialty journals as well. So here we're talking about the pediatric ophthalmology journals. So try to put in before you leave with it. And have your targets when you're planning to do it. So certain fellowships anyway have the targets, but if not, you can have that. At least one case report should be there before you leave, or retrospective studies are done. And once you're out, you can continue to do the same thing, right? And one research project. So try to have targets so that you can work on your academic part as well, help yourself to grow as well. Then important training, that is in addition to not your training. Training others is what can also help you to grow. And that's the aspect which I want to tell. Teach your junior fellows, the postgraduates, take lectures related to it in terms of normal evening classes or workshops or in the clinics in after routine hours, and that will help you grow further. You will know where your deficiency is and you can work on them, and that will also work. Assist surgeries, one learns better when you are assisting than you are actually doing it, because you're not the operating surgeon, so you don't have the fear. So can handle complications, take proper decisions better when you are trying to assist as well. And then obviously your mentor is happy that you are able to do that. And then importantly, the last part is communication. This is also very important. What we have to look, because how we should be able to talk to our patients is important. And what we need to understand, it's a child. So it's hardly talking to the patient, that is a child, but to the parents. And how importantly to handle them is there. Explain to the parents the problem and also the treatment, and that helps build a very good rapport. Learn to handle unhappy patients and see how your teacher, your mentor is handling the same. Always ask the question why, so that you know how to treat it. Like for example, this 62-year-old female who came with gradual constriction of vision in both eyes. You can see there is completely constricted fields, both eyes pseudophakia with normal retina. But it's importantly why this happened. And a proper history showed that this was cancer associated retinopathy. So yes, ask questions. Sometimes they'll say there's no treatable condition, there's nothing you can do, but more than that, why is it happening, so that you are able to improve your knowledge as well. Then the other aspect, right, counseling and treatment goals, you have to talk, especially in conditions like pediatric ophthalmology strabismus, we have to be correct in what we say. Like for example, this patient with the right third nerve palsy, as you can see, only the moving lateral rectus muscle. So you have to counsel well that it may require stage surgery, and eventually we may be able to only get the eyes to the center, not anything more than that. Like, this is what we got, good outcome, but there will be no motility. So really importantly, tell them what is the final goal, that they do not have too many high expectations, how we can achieve it, and what are the limitations, and maybe requiring stage surgery. But always remember never to give up on treatment. Certain conditions we may not be able to do, like retinal dystrophies, but remember there is always rehabilitation available, especially in a child. Vision stimulation and visual rehab should be done because the child has the entire life to go. That is to be importantly decided. So in a pediatric ophthalmology, look at the child as a whole. One has to rule out other systemic issues and syndromes which are commonly there in children. So exactly, you may need to have a very good coordination with other specialties like pediatricians, the clinical geneticists, neurology, and so much. So you have an entire teamwork who looks at the child completely and not just looks about the eye. And that is the most important part. So I want to end up by saying that some people may always throw stones in your path. It depends on what you want to do it. Build a wall or a bridge. Remember, you're the architect of your life. Be thankful of what you get and make the most out of it. Enjoy your fellowship journey and have a wonderful life. Thank you very much.
Thank you.